Now, we will review assessing beyond pain. As a clinician, it is important to understand the concepts regarding managing pain and assessing beyond pain. So, we will review some concepts on pain management that I am sure you already know, and then, building from that, I will present a new way to look at suffering. I believe this will have an impact on how you connect and assess patients and their families. Did you know that the word patient originally meant in Latin, the one who suffers? The most common presenting complaint to healthcare providers is pain. Patients come because they are suffering due to an illness or a medical condition. Pain management is a critical component of high-quality patient care. As you know, pain scores are recommended to improve consistency of assessment and management of pain. Pain scores and charts are used to determine pain levels, triage, priorities and treatment guidelines. But, to offer a better patient and family-centered care, we need not only to assess pain but also suffering. A lot of people think that being in pain and suffering have the same meaning. But not really. Researchers conceptualize pain and suffering as different. Pain is the physical sensations that tells you something wrong is happening with your body. Suffering is the interpretation, the psychological and emotional pain that comes with the physical pain. Working as a healthcare provider, we deal with pain and suffering all the time. To assess properly pain and suffering, we need first to understand well this concept. So allow me to explain for a few seconds. In healthcare, pain and suffering have three causes. First, the inherent suffering, which is caused by the diagnosed condition and its symptoms.
Dad, it hurts so much. It hurts.
Research shows that when a pain score is recorded, there is a significant reduction in the average time in providing pain management. Pain scoring has value in raising awareness and prompting action. It is extremely important to follow your department's standardized pain management protocols. Another inherent suffering occurs as part of receiving medical treatment, procedures and medications. Treatments may be uncomfortable, have adverse effects, and disrupt one's life.
Dad, how long do I have to have this cast? It is itchy, and my shoulder hurts.
Research shows that patient satisfaction scores on pain management were not primarily based on patient receiving pain medications. There are other factors appear to be more important, like showing concern. And that brings us to the third type of suffering. The third is avoidable suffering, which is caused by poor care coordination, lack of teamwork, delays, poor communication, intensive negative emotions.
Dad, what are we waiting for?
I am not sure. I think is the discharge papers.
How long will it take?
I don't know. They did not say.
It is so frustrating. I am exhausted.
It is recommended that when possible, use the pain score in the patient's room. This shows the patient that you are aware of the pain. Also, while the patient is waiting, come back to inform for delays and reassess the pain levels.
Anna, I am so sorry about the wait. We will take you to X-ray in 10 minutes. How is your pain?
Reassessing pain shows concern. Avoidable suffering occurs when patients' needs are not met. This causes a decline in patient trust. Unnecessary wait makes the patients and their families feel a sense of urgency and hopelessness. Conflicting information gives the impression that there is no teamwork among the staff. When something goes wrong and nobody apologizes for that, it makes the patient feel unheard, not important. Research shows that the primary drivers of satisfaction and willingness to return or refer others to a healthcare institution are 1. Being informed about delays. 2. Overall physician rating. 3. Nurses' attention to needs. 4. Control of pain. Achieving optimal patient-caregiver satisfaction scores is highly dependent on the quality of interpersonal interactions and communication. So there it is. Preventing avoidable suffering is key to improve care. And with it, the patient and family experience. In my next video, we will review different response styles that we use with patients. I challenge you to become self-aware about how well you assess suffering. Also, do not forget to click on the link below for a self-reflecting exercise. See you in the next video. Thank you for learning with us.